Good morning, everyone. Thank you, all of you. I would like to say thank you for all preparation team, including especially at this Continental Public Health of Institute. Let's come to the program one on the adolescent and the youth health, especially adolescent and the youth health policy and the meaningful youth engagement in Ethiopia. My presentation have some those outlines, background, policy strategies, some issues or problems, and also interventions where Ministry of Health goes through, opportunity, challenges, and the way forwards. As you know, Ethiopia is one of the African country never colonized ever. For those who are not aware of it, and also we have our own calendars and the letters. So these are the key unique. It makes Ethiopia from African country. We have 12 regions and 2 city administrative, around 129 people, according to the estimate, even if there is no census recently. Out of this, 43%, one-third is adolescent, as mentioned previously in keynotes and yesterday on the Excellency's speech. Ministry of Health more focus on adolescent and the youth health and give more attention from the federal level to the lower level by making the restructuring adolescent and the health as one part of the maternal and child health, and also adolescent by diligently work in designing the policy, the strategies and guidelines. Now also adolescent and health have a strong TWGs, those coordinate all over the programs. As I mentioned before, 33% of the community goes to adolescent and youth health. According to the policy, 10 to 29, Ethiopia says adolescent and youth, which is around 42%. These are the policy environments. Globally, Ethiopia is one associated the ICPDs, SDGs, and FP 2030 commitments, and also nationally we have a health policy, and also now revised health policy as our Excellency Ministers spoke yesterday. RH strategy, which highlights the adolescent and youth health. We have also separate adolescent and youth health strategy starting from 2007 and revised 2050. The second one and the third one is revised in 2021. We have also adolescent and youth health strategy, service quality standards, also minimum service package at workplaces, national smart start and standardization and scale up. This is for the sake of teenage pregnancy reduction. The document is prepared to reduce the teenage pregnancy as an initiative, as 3 years initiatives. As I mentioned before, SDG commitment, FP 2030 commitment also puts the adolescent and youth health as a center. Meaningful user engagement, especially we have meaningful adolescent and youth health guidelines to engage meaningfully the adolescent and the youth, as you see yesterday, the president of the Youth and Adolescent Council. These are the picture of some policy environments for you. According to the national strategies, we have 4 strategic objectives and around 8 strategic priorities. Those strategic objective and more is focused on health literacy of the adolescent and the youth, access, and also the quality and the leadership and the meaningful engagement are the main strategic objectives and the strategic priorities. As I mentioned, Ministry of Health recognizes that harnessing the demographic dividend, especially the adolescent, one-third, lifting one-third behind, there is no universal health coverage. This is the Ministry of Health theme. Investing on adolescents brings the triple burden, the triple dividend benefit of adolescent and youth for now and for the future of the next generation. These are the why we need to invest adolescent and youth health. As you know, demographic dividend, public health rationale, economic rationale, and it is also the right of the adolescent also. As you know, when you say the public health rationales, 3,000 adolescents are died per day from preventable cause, which accounts African, including Ethiopia. So we should invest on adolescent and youth health. These are the major problems in Ethiopia. What recent data we have, especially DHS 2060, child marriage, female genital mutilation, teenage pregnancy. As the Honorable Dr. Ndegana mentioned, most of the adolescent and the youth health problems are not supported by the evidence. So it needs more evidence, like what started with the inter-regional collaboration arise also. So the other one is especially with the nutrition, adolescent nutrition also needs focuses. These are the unmet needs regarding with family planning. Adolescent and the youth have more unmet needs. Those needs more interventions. As mentioned previously, injury or road traffic accidents, substance use and mental health is one of the most problem of the adolescent, which needs more attentions. These are the adolescent and the youth health mortalities, as you see here, from the 2000 to 2060, there is a significant reduction, but needs now also more attentions. For these problems, we have more, we have policy in place, but also we have now try to prepare the teenage pregnancy roadmap for the sake of reducing teenage pregnancies. These are the key interventions nationally planned with the adolescent and youth health desk, expanding the youth-friendly service and involving or engaging meaningfully youth. Adolescent and youth is one of the strategic initiative. Reduction of adolescent pregnancy is the second initiative. To reduce those initiatives, we have 3 years initiative, especially ISM, focusing on smart start and a minimum service package of workplace. Especially smart starters is planned to implement in all over the countries, in all regions, to reduce teenage pregnancies. But it needs multi-sectoral engagements and also evidence support. These are the initiatives. The second one is youth engagement at all level, is the response from the Ministry of Health. It needs more attention at all level, ensuring the adolescent or young people representation at all level needs more attention. Unless we engage them, we cannot find out their problems or intervene their problems also. Strengthening the National Council. We have a National Adolescent and Youth Council established 4 years ago, so 4 years back, and also now it is strengthening from time to time, including cascading the youth and the adolescent council to the lower government system. The third one is advocacy. Advocacy is very important especially to increase the adolescent literacy. Ethiopia celebrates annually the National Adolescent and Youth Health Forum by meaningfully engaging the Adolescent and Youth Health Council. These are the first adolescent in 2020. We start in 2020 by connecting the dot for adolescents and the youth. These are, as you see here, the president of the Ethiopian FDRI and former ministers and state ministers are here on the first Adolescent and Youth Conference. The second one is by the theme of celebrated by the theme of innovation for better youth health services. Is more all adolescent and the youth forum are celebrated by different agendas, especially by flash presentation on the adolescent and the youth health innovative evidences, and also the success project also are noted at those celebration. On the third one, these are the panel and also the theme where third Adolescent and Youth Forum were celebrated. The fourth and the the biggest from all the Adolescent Youth Forum is the fourth Adolescent and Youth Health Forum. The power of partnership. The theme is the power of the partnership, meaningful adolescent and youth engagement for improve the health. This is on this forum, almost 300 adolescents were personally engaged, and also it was live streamed, and also virtually most of the adolescents were addressed. As you see here, most of our ministers and UN agencies will deliver their keynotes on this adolescent and youth health. This is a celebration of the team who engage on the preparation team. The fourth one is the adolescent and the youth health needs multi-sectoral collaboration in the partnerships, especially education sector, women in the social affairs, and the industrial parks. Since most of the adolescents serve in the industrial park, it needs those engagement in the collaboration. As you see here, adolescent and the youth health needs of all stakeholders interventions, starting from adolescent himself, relatives, families, teachers, sports, and researchers, musicians, journalists, and also leaders. Adolescent needs those engagement on those stakeholders collaboration. So when we come to lesson learned, especially based experience through the program implementation, leadership engagement and coordinations matter, especially as you see from our Excellency Minister yesterday. They need engage on leadership of especially on adolescent and youth health program. The engagement is meaningful. There is also, as I mentioned, the coordination, strong coordinationship of the adolescent and the youth health TWGs. Social media engagement is Ministry of Health have a Facebook and the TikToks and to engage adolescent and the youth health. Also, there is a different applications for the, for example, Unit Hub on adolescent and health prepared to deliver information for the adolescent and the youth health. National Adolescent and the Youth Health Forum is our best practice that should be scaled up to the intercontinent. The strength is National Youth Adolescent Council and meaningful adolescent and the youth health at all levels, including the facility. We reach now 30% of our health facility engages adolescent and the youth health. These are the most best practices being implemented. Opportunities, as you know, those are the opportunities. We should use those opportunities, and then we need another additional opportunities, especially strengthening the evidence generation and group formation, intercontinental and the global group formation for adolescent and youth health is more important. Low, the challenge there, even if those activities were done, and also the increment of adolescent and youth health services those are the challenges, especially even if we have celebrating adolescent and youth health forum, and also in media engagement, there is low adolescent literacy, which needs more intervention. Lack of budget, as mentioned, lack of budget is also to scale up the started program as a large. As I mentioned before, Ethiopia is the largest populated, second populated country from Africa, next to Nigeria. It needs more budget, more infrastructures, huge gap, especially on youth-friendly service or adolescent and youth health. There also is a misconception, especially on RH services. There is also man-made and natural disasters, which needs preparation, and also multi-dimensional anti-choice also there. Is also the challenges. The way forward, it needs more structural arrangement and coordination platform at all levels of the health system, strengthening advocacy at community, and also resource mobilization at all level, strengthening multi-sectoral engagement, inclusion, adolescent and the users across all strategy documents, ensuring meaningful youth engagement across all levels, all programs, developing digitalization for adolescent and the health, especially as started in adolescent health application for the sake of addressing all adolescents, resource mobilization and general evidence generation, especially what started now on our rise. It needs more collaboration with intercontinental and the global. Thank you. God bless you.